Hello, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So, in this presentation, we will discuss about the remaining types of the benign bone tumors. So, first is fibrous dysplasia. It is a replacement of the medullary bone with fibrous tissue and woven bone. It can affect one bone, which is known as monostotic, or many bones, which is known as polystotic. Fibrous dysplasia leads to bone weakness, so it can cause angulation, bend of the bone, which is known as Shepherd's crook deformity. So as this figure shows the hazy appearance or ground glass of Shepherd's crook deformity, as is seen in the femur bone. There is a angulation bend of the femur bone. Next is simple bone cyst. It is a unicameral bone cyst. Is a cavity found within a bone that is filled with fluid. It appears during childhood, typically in the metaphysis, and non-tumor tends to heal spontaneously. It is a form of a large bubble inside the bone, mostly in metaphysis. It is shown in the femur bone. Next is giant cell tumor of bone. It is a very rare, aggressive benign tumor. It generally occurs in between the age of 20 and 40 years, and the bones affected commonly are those around the knee, that is lower end of the femur and upper end of the tibia. The lower end of the radius is another common site. Very rarely seen in children or in adults older than 65 years of age. It is formed by fusion of several individual giant cells into a single large complex cystic. So it is shown in the radius bone occurring in the end portion of the long bones. Its major common complaint is pain and swelling, and the pain increases with movement and decreases with rest, but it progressively increases with it. So next is treatment. Treatment include excision with reconstruction, curettage with or without supplementary procedures, amputation, and radiotherapy. So first is excision, second is excision with reconstruction. It means arthrodesis by the turnoplasty procedure. In this technique, the required length of the tibia is split into two halves. One half is turned upside down and fixed with the stump of the femur left after excising the tumor. Next is fibular grafting. It is a bridging the gap by grafting. Next is arthroplasty, which means bone replacement. As this is a giant cell tumor. This figure represents the surgery of turnoplasty. It is a fibular grafting, and next is the replacement of the articular surfaces. Thank you.